Welcome to Access Zen with Gregory Foster. Our program will help you set a more perfect balance between your inner world and the outside world. And now, here's your host, Gregory Foster.
And good morning, everybody. How is the week going out there? I'm Gregory Foster. You're listening to Access Zen, and this is our 5th show. And I just want to thank all the listeners who have had a chance to listen to us, and we really appreciate you all. Thank you so much. So we've got a really great show in store for you today. This is a health show, and we're going to be bringing on your favorite doctor, Dr. Vicky Vaudon. And we're also going to be bringing on her colleague a little bit later, and his name is Dr. Robert Janda, and they both work together. And so what we're going to be kind of focusing on here in a few minutes, and I'm going to do a little wrap-up from last week's show as well. I like to do that, tie everything together. But we're going to be talking about how we can stay lean, clean, and serene, and healthy. Obviously, there's lots of bugs floating around out there and lots of stress, and we just want to figure out how do we take good care of ourselves, inside and out. So that'll be coming up here in a second. So last week's show with Betsy, I thought that was just exceptional. And her messages, I like to encapsulate, were all about taking personal responsibility. It's not just about changing the outside world. It's really more about how we are inside with ourselves and how we create a positive attraction action to happen in our lives so that we can become a magnet for the good things to happen, and then we can share that with others. The other key takeaways were keeping a big heart, keeping an open heart, and being very compassionate with ourselves and with others. And when we set that out, we begin to initiate that law of attraction, and good things begin to happen to us. And we'll talk about that more in the coming episodes, because I know we're dealing with a lot of fun stuff out there in the world, and how do we stay zen? So, more about staying in peace when stressful things happen, and what happens when we get stressed out. And that's kind of the theme of today's show, because what I've noticed is, something happens in my work life, mostly it's my work life, it almost immediately, can trigger us to start to get that scratchy throat and start to feel kind of run down. And then if we're not careful, if we interact with other people who have stuff, then all of a sudden, whammo, we've got, one of these, viruses that have been going around. And a lot of my colleagues have been knocked out for like 2 or 3 weeks, and when they really couldn't even work at all. So I'm grateful that I get to work with a good doctor, Vicky, and she has been just sensational. And we're going to kind of talk about how she takes care of her patients and me, because I'm one of her patients, from a structural perspective, from a nutritional perspective, and a supplemental perspective. And so the theme of the show is how to be lean, clean, and serene. So give a big, warm welcome to Dr. Vicky. How are you, Dr. Vicky?
I am doing great. How are you this morning, Greg?
I'm doing fabulous.
That's good to hear. Really good to hear. And I really appreciate being here this morning.
I know. And I have to tell you, I really owe a lot to you, because last week was one of those weeks. And at the end of the week, I was going right towards, that pattern, and I was trending really quickly towards getting very sick. But I followed all the remedies that we've talked about, and I'm pretty much recovered in 2 days. And I'm just on that, that last little bit where there's still a little bit of congestion and that kind of thing. But I want to thank you so much for all the help you've given.
Oh, there's absolutely no problem with that, and that's what our goal is in working with patients, is to make them optimally functioning in every situation that you encounter. And with stress in our lives and the bugs that they are and the amount of environmental exposures that we have to things, that we really need to have an optimal immune system. And an immune system that's functioning optimally is really based upon what your spinal health is about, number one, having the proper functioning spine and curvatures of the spine, and doing a good core structural program in chiropractic is really key to your physiological health and mental and spiritual health as well. So,
Yes.
Basically, my goal for my patient is that they become lean, clean, serene, radiant, strong, and vibrant with an abundance of energy.
Ooh, say that one more time. I love that when you say that.
My goal is that every patient that walks through my office here becomes lean, clean, serene, radiant, strong, and vibrant with an abundance of energy.
Wow, that's great. Well, it's so true, working with you. And I'll just real quickly tell the story of how I came to you, the condition I was in, because I know that a lot of our listeners can relate to this. So I'm a pretty healthy guy. I do a lot of yoga. I do a lot of hiking. I, thought I eat pretty good. And, over the year, last year, I did gain a little bit of weight, about 15, 20 pounds, which I'm a tall guy, so it doesn't show up as much maybe in my physique, but it was there. I could feel it. I could tell. I was a lot slower when I was doing my stairs in Santa Monica and all that fun stuff. And my wife, unfortunately, got in this, fairly bad collision. She's okay. But we got referred by one of my good friends to see Dr. Vicky. And, of course, I always think, well, I'm going here for my wife to support her. But as it turned out, it was the other way around. Obviously, my wife got treated as well. But it turned out that, I had stomach problems. I had this back condition that I'd been kind of ignoring for the last couple of years. I wore these special shoes and just kind of thought, well, it'll go away. And then I had a lot of stomach pains. And so Dr. Vicky said, you know what, I can help you. And so that's kind of how her and I met. And Dr. Vicky, if you want to kind of take it from there and tell us all the great stuff that you kind of recommended for me, because it kind of relates to a lot of the stuff you did for me relates to the kind of stuff you do for an average client, right?
Well, thank you. I would love to tell you about this, Greg, and those listeners out there. We start with a structural standpoint, and when we're dealing with anyone's health, we usually take spinal radiographs if it's indicated. If you haven't seen some x-rays, or had some x-rays, I should say, over in the last couple of years, we like to take an x-ray to see what's going on with the actual spinal curvature. And if the curvatures are interrupted, in other words, they're not normal curvatures of the spine, then we have interruption in function of the body, because the spine is the housing of the central nervous system. The spine has a lot of responsibility in our bodies. And so as the central nervous system relates down through the spine and through all the plexuses that come out to innervate, in other words, they connect to all of the organs of the body, if there's pressure on the spinal column and the spinal cord from the vertebrae, it's going to interrupt the function of the particular organs of the body. Your digestive organs, your liver, gallbladder, your stomach, pancreas. It can also affect your vocal cords and your tonsils. And, the spinal cord can be interrupted by innervation that is interrupted from spinal subluxation. And subluxation occurs when the normal curvature of the spine is no longer functioning at an optimum. So by doing chiropractics and reducing subluxation complexes, we can free the spinal cord and the nervous system to do what it's designed to do. And if we have the subluxation complex is where the bones are just not moving properly, and we have like the actual curvature has changed. And through chiropractic adjustment, we can actually relieve that subluxation, which takes the pressure off the nerve root, which then all of a sudden your symptoms start to disappear. And instead of putting a Band-Aid on the situation, say that someone has a neck ache or headache or something, they might take some kind of over-the-counter medication for that, when the actual cause of that neck ache and headache is usually spinal subluxation in the cervical spine. We reduce the subluxation, and then voila, then the pain is gone. And so it's through this technology that we increase and enhance the body's ability to heal itself and to maintain itself. The brain basically has is conducting a lot of information from the brain down to the body, and there's approximately 350 million impulses per second that comes down the spinal column through the cords and through the plexuses and innervates your organs. And if there's just a dime's pressure on that nerve cord that's coming out of that plexus, you will reduce the information that goes from your brain to your body 40 to 60%.
Hey, Dr. Vicky, that is really great information, but I also have to tell you that it looks like we have a caller this morning.
Oh, we do? How wonderful.
Chad, if you want to bridge him on, I'd love to have our caller this morning.
Well, good morning, Dr. Vicky. This is Humphrey.
Humphrey.
Oh, Humphrey, how wonderful to hear from you. How are you doing?
I'm doing all right. I just wanted you to explain when you walk in the door how you lay down on that nice, warm bed of heat and and get a massage, and then get adjusted. What's that process all about? Because it's pretty unique to your facility.
Yes. Well, oftentimes there's inflammations in the body and tension in the body that is wonderful to relieve with some moist heat and stretching techniques that the therapists do for us. And, of course, the myofascial release is perfect as a pre-adjustment procedure. And when we do that, oftentimes the adjustments hold a lot better. And, of course, it's always good to get touched and to have that fascial release. I mean, there's no doubt about that. And that it has been unique to our office for many years. Yeah, thank you so much for that comment.
Well, I'm due. I'm due for one of those.
Yeah, so Humphrey, so our listeners know, Humphrey is actually, ironically, the one who introduced me to Dr. Vicky. He'd been telling me for almost years to go see her. Is that right?
Yeah.
Fantastic.
Yeah, Dr. Vicky is wonderful. She can wake people up from the dead.
Well, thank you so much, Humphrey. It's really great to hear from you.
Okay, I want to listen to the rest of your show.
Okay.
Thanks, Humphrey. We appreciate the support.
Okay, goodbye.
Goodbye. All right, so Dr. Vicky, you were kind of giving us a really good technical explanation of, what goes on from a structural point of view. So I want to talk about more from a symptomatic point of view because, in my case, and you took the x-rays, and they were fairly revealing, but the good news is there was nothing we saw in there that wasn't immediately correctable. I got in there in time. Is that right?
That's correct. You see, if you don't let your spine go into, extreme degeneration, chiropractic care, you can do corrective care to restore the natural spinal curvatures, and then henceforth the function of the nervous system can work at 100%. And basically in your situation, we relieved several cervical subluxations and thoracic through your mid-back area, which relieved the stress on your digestive system, and henceforth you could start digesting better. Also, we had found that there was some parasitic problems with your digestive system. We gave you herbals to correct that, and then, of course, your body could really correct itself after that a lot better and improve the digestive function. So we find that frequently there are parasitic involvements with people's health, and, people think, well, gosh, you have to have, they think, well, I'm not an animal or a dog, my dog has parasites. Well, yeah, we have parasites too, and it's not quite as obvious to us because we don't really look at it that frequently. But there are definitely many of our cases that come in here where people are involved with parasitic infection.
Well, that's very interesting. We're going to get more into that, and I also want to continue, talking about the structural part. We're going to take a break, listeners, in about 20 seconds here, and then Dr. Vicky's going to continue, and then shortly thereafter, her colleague, Dr. Janda, is going to join us. I'm Gregory Foster, and you're listening to Access Zen.
And now, let's return to Access Zen.
Hi, everyone. We're back. I'm Gregory Foster, your host. You're listening to Access Zen. And we were continuing just before the break. Dr. Vicky was talking about, parasites. And I know that's kind of like, what? I don't have a parasite. Well, that was me. And if you remember in the beginning of the show, I was talking about stomach aches. Well, I've had these stomach aches for like years. And they had, really intensified. And I've, taken different stuff for it. But it never really went away. So I had this lower back pain that was starting to, starting to impact my yoga practice and really feeling comfortable, and I had this stomach problem. So Dr. Vicky, I know there's probably a lot of folks out there that may have these phantom stomach pains, and they're kind of like me, they're in denial. So tell us more about that, and then I want to get back to the structural stuff, and then we'll introduce Dr. Janda.
Well, thank you so much, Greg. Again, we find that many of the patients do have parasitic type of involvement, usually digestive, and of course it can go into other organs of the body, which Dr. Janda can explain quite a bit more than myself because he's really quite an expert on that topic. But the parasites and the digestive function can affect the spine. There's a feedback system that the body has where if you have problems chronically digestively that it actually revolves back to the spine causing spasms and subluxation actually within the spine. So the body is just an incredible functioning unit where one part can alert another part that something's going wrong. So oftentimes if we have someone with spinal pain, it is a referred pain from a organ, so the organ can actually speak out through the spine. And we find that many times. This last week I had such a case where there was a gallbladder problem that was being referred to the right shoulder and rib of this patient with acute severe pain. And when we actually examine the patient, the pain is not proportional to the musculoskeletal. It's way over, the pain's over the top in regards to, it being an actual muscle problem. So we have to look for other things, that could be related to. So in regards to, your low back, if you'd like to talk about that and that type of a situation, we have got a lot of gravitational forces in our life because, you're basically a tall guy, and if we don't look at the gravitational forces on the spine and try to correct how we are functionally working on this earth, in other words, stretching properly, decompressing, and getting chiropractic adjustments is just really key to the structural integrity of the low back and henceforth the symptomology of the low back.
Yeah, and I will say I started working with you, I want to say around November, mid-November, and it was a little uncomfortable at first with some of the adjustments and all that, but you said just hang with me. And I did, and I will tell you that now I am pain-free, completely pain-free, first time in probably, I would say, 3 years.
That's outstanding. We did a lot of spinal decompression, and which has to do with the type of a table and actual equipment that we use here. We also use inversion units that help to decompress the spine with gravity. And Dr. Janda has got a spinal decompression computerized unit called the DRX 9000. We utilize that quite a bit at the office here. And that actually reduces disc problems and helps them to start healing. And, we basically do a lot of intervention here in regards to people having potential surgeries. I mean, we can actually heal most of these situations. And that we would like to say that we're very proud of that fact,
That's awesome. Well, I think this would be a great time for our listeners to get introduced to your colleague, and maybe you could say a few words before he talks, but I want the listeners to meet Dr. Robert Janda, who works alongside Dr. Vicky in her clinic.
Absolutely.
Oh, hello, Greg. This is Dr. Janda.
How are you this morning?
Good. Thank you for having me.
Thanks for being on the show.
Oh, you're welcome.
How's your morning going?
Great.
So I think you've been kind of listening in here in the background.
Yes.
And so you and Dr. Vicky work together, and you have a little bit different of a specialty. Is that correct?
There's tremendous overlap, but just by following your own interests, you'll develop more information in one area or another than someone else. But
sure,
yeah, that's natural.
Well, you have a really interesting background, and I just wanted to highlight a couple of things. So you have a background in acupuncture, so tell us a little about that. I also see that you have a Gestalt and Jungian psychological background. Is that right?
Yes. I got a master's in clinical psychology a number of years ago.
Wow.
And it's still an ongoing interest, although at the moment I'm not interested in therapy so much as art and
I saw that too.
Concerns, yeah.
Well, what I found kind of interesting, we'll get a little bit in, and we want the listeners to get to know you and love you like they do Dr. Vicky, and I know that they will. So one of the things that I noticed with I graduated from the University of Santa Monica as a master's in spiritual psychology.
Oh, okay.
And one of the things that we did there, doctor, was Gestalts. So maybe you want to share with your listeners what that therapy is, and I know I don't want to diverge too much, but it was kind of an interesting aside.
Yes, Gestalt. I had a series of interests when I was involved in psychology. I started out with interest in psychoanalysis, and I became interested in Fritz Perls, who developed Gestalt therapy, and he based it on Gestalt psychology, which was the idea that the brain perceives anything with a figure and a background, and that when a figure is used up, when it's finished, the next thing will merge out so that you form a new figure. And so your interests will sort of scan your perceptual field and tend to bring out things that are of importance to you. And so they use that in psychology and in therapy by having you direct your attention internally and just letting things merge out of your unconscious and your feelings about things and so forth. And then they would have techniques of dividing you up into a good person and a bad person. You would talk to yourself and so forth. But they're all based on the idea of a figure ground background and trying to complete the emotional components of them so that the next thing can come forward.
That's fascinating, and I'll just share this. So when we do the work in the school, Dr. Janda, they set us up in like these little trios of 3 folks, and one person's a silent observer, one person is a facilitator, and the other person's kind of like a talker of what their challenges are. And I remember walking in there one day, and they had a 4th chair, and I said, "Well, who's going to sit in that?" And they said, "You're Gestalt." And I said, "Okay, that's going to be interesting." So talking to various aspects, and I think it works pretty well like in dream therapy too, where you go, you talk to that aspect of your dream that you want to get information from. Is that right?
Yes, in dreams, the Gestalt psychologists regard every aspect of the dream as an aspect of yourself. And so if you dream about a car, you would put the car in the chair and talk to the car, and then you'd switch places, and then you'd be the car and talk to the person and so forth. And as you go through that process, the meaning of the car would become evident to you. And so that's the way they do it.
Yeah, I found that to be very helpful. So you have a really wonderful, deep background, and tell us about your art. Where are you going with your art? And I know you're also writing a book too, right?
Well, I just completed one book, and I'm writing another one. The one I just finished is on pain. It's called The Secrets of Pain. And anyone who's interested, you can find it on my website, naturalcuredoctor.com. I wrote it because a lot of our emphasis in Western medicine is on specialization, where if someone has a hand pain, they go to a hand specialist, or if they have a knee pain, they go to a knee specialist. But over the years, I've had quite a few people that have come to me that have gone to specialist after specialist after specialist, and their problems are not resolved. And sometimes these things are very easy to fix. I mean, sometimes literally 5 minutes. And I started wondering, well, why are these things so easy to fix, and so many specialists are not fixing them? And I came to the conclusion that one of the main reasons is because they look at the body in isolation, and many problems of pain are problems of relationships in the body, where you can have an infection in one part that's affecting something else, or you can have a spinal disruption that's affecting something else. Unless you see those relationships, you're just simply lost. You can't solve the problem, because it's not the pain location is a manifestation of it. It's not the cause. So anyway, that's what the book is about. It's about the benefits of a generalist looking at things rather than a specialist.
And I think that's a really, really great point, because your educational background is incredible, and I've worked with a lot of different doctors too, and I do notice that we do tend to be a little bit over-specialized, and that's part of the reason why I wanted the listeners to hear your background. So when they're, wherever part of the country or the world that they may be at, that when they're looking for somebody who is going to be qualified to put their body into the care of that person, that they can start looking for someone who's got a really diverse, wide background as you do. I think that is a really important component of finding someone to take care of us.
Yeah, I think at times that there's a big advantage to that. And at times specialization is an advantage, but they both have their places. And I do think our culture overemphasizes specialization.
Yeah, that's very true. We're going to be taking a break in about a minute and a half, so I wanted to maybe get started a little bit. And Dr. Vicky, of course, you're still back there with us, correct?
Oh, absolutely.
Wonderful. So I wanted to get a sense of, so we can maybe talk about how the two of you collaborate together, and work together and what that experience is like. And then when we come back from the break, Dr. Janda, I'd like to maybe have you take us through some of the clients, some of the more, I'll call it acute situations that you've encountered and how you've treated that. So, Dr. Vicky, what's your perception here?
My perception on how Dr. Janda and I work together?
Yeah.
Oh, it's very synergistic. We do look at a lot of functional structural things and compare notes, which is really wonderful to have someone obviously to work with. But I think that the huge benefit that I have in working with Dr. Janda is his insights with the parasitic functions, I should say the parasitic problems that we have with the functional aspects of our patients. And he's very key at diagnosing those things like in just a matter of minutes. And I have been learning from him some of this technology, which is helping me tremendously in my practice. But if he is here, he is so kind to volunteer his services a lot of times with my patients so that we can get to the bottom of things really quickly. And sometimes we are able to diagnose things that might take hours to weeks to diagnose from a therapeutic laboratory standpoint, in doing diagnostic work, in doing, stool samples, et cetera, things like that can take sometimes weeks to determine, and where they can actually be determined in just a few minutes through therapeutic muscle testing.
Well, that's really, really great, and I just want to let our listeners know, and we're going to take a break here in about 10 seconds, that what I've noticed in being in your clinic is just how collaborative you all work together so beautifully, so I appreciate that. So when we come back from the break, we're going to talk more about nutrition with Dr. Janda and Dr. Vicky. I'm Gregory Foster, and you're listening to Access Zen.
And now, let's return to Access Zen.
Okay, and we're back with Dr. Vicky and Dr. Janda, and this is your health show, being lean, clean, and serene. So let's talk about the clean part. How does a client work with you from a diagnostic perspective? And I know, most places do blood tests and things like that, and I know you do that too. But if you need information quickly and you want to get someone on some good supplements to help get them clean, what do you do?
Greg, that's a really great question here. We've got a couple of wonderful diagnostic tools here, and one that we do is called a limbic stress assessment. It's a computerized program that the person actually puts their hand upon a Palm Pilot type of a device, which generates information to a computer, which is computerized, and the software in it is pretty amazing to diagnose actual physiological conditions and even parasitic conditions in the body. Technology that was developed originally through NASA, and it has evolved to tremendous heights in the community of nutritionists, chiropractics. It's a pretty amazing technology. It's done through differential diagnosis of differential ratios that are created for very unique physiological conditions of the body. And it can, through the computer, just in a few minutes, we can actually diagnose certain types of parasites as well as other physiological, digestive, et cetera, conditions. So that's one of the technologies that we used on you.
Yes.
And it worked great. We found what we needed to find out, so we were able to use the herbal that we used to, of course, confront the parasite. So that is one technology that we can use, and it's fairly quick. But as you said, we do use laboratory and other diagnostic techniques, so there's very, more accepted things in the scientific community at this point. But the bottom line is that we need to be able to get a fairly fast diagnosis with a lot of patients so that we can get the clinical results a little faster so that people can get some relief. And
I will tell you, that's what you did for me, because I told you I had these stomach pains, and you said, oh, you got a parasite. And I said, no, I don't. I don't have parasites. And you said, yes, you do. And we did the little test, and sure enough, it showed that I did. So you went to your little cupboard, and you recommended some wonderful little supplements. I say wonderful in the sense, not that they tasted great or they were fun to take, but that I got immediate relief.
Well, most antiparasitics are not very fun to take. They're usually bitter. And, you have to have diligence in taking them regularly, too, because if you don't stay regular, then the parasite will make its home, a little bit more comfortable in your body, every day. So, anything that you do is just like taking an antibiotic. If you do not can follow through with the therapeutic doses and at the intervals that you need to take them, then, of course, you're not going to get the results that you want. And so we depend on people being reliable that way, as patients.
One of the things I noticed is that it actually got a little bit intense for about 2 weeks, and you said, Greg, just stay with it because you're going to feel so much better. And that's one of the things I just want to encourage our listeners. When you're doing a treatment, we're always told, kind of our culture, that everything has to kind of feel good. Sometimes it does get a little bit more intense, kind of like a good workout. You feel a little sore the next day, and you think,
right.
I don't want to go back in. Keep going back in.
Exactly.
It'll go away, it'll pass, and in my case, within 2 weeks, I started feeling incredible, and now I don't have stomach pains anymore, I have to tell you.
Correct. And there's also some things dietarily, Greg, that you're dealing with, is that, as a family unit, as people in the most of the United States at this point, we've gotten out of the kitchen, we've gotten out of, doing things the way that our grandparents, and great-great-grandparents at this point, how they ran their lives and how they did things. And we've gotten out of the kitchen. We've become more of a fast food, convenience society, and where they want to take a pill for a quick fix and things like that. But, we're trying to teach people how to get back to the garden, so to speak, how to get back in the kitchen. And for that purpose, I've also developed a health camp at this point, too, where people can come and learn how to get back into their bodies again and get back into life so that they can schedule themselves back into their lives, Such an important thing.
Well, I want to hear more about the health camp in a little bit, but I don't want to leave the part about diet, because that was the other thing you told me. You got to stop eating all those potato chips and cookies and processed foods. And
Absolutely.
get into vegetables. And not become a vegetarian necessarily, but eat a lot of vegetables.
Oh, absolutely. Yeah.
And you did. And my diet is now, probably 80% vegetables and salads, and I've gotten some really, really great recipes. So there's not really much of a sacrifice here. Actually, it's better,
Oh, the taste is amazingly better than your convenience foods. And once you get off of convenience foods and get back into the kitchen again, it's really a gift to yourself and your family. Because not only the health benefits, but you're more productive, you're radiant, you're strong, you're vibrant, you have an abundance of energy when you switch the type of fuels that you're, consuming.
You had me go get food processors and juicers, and you gave me all these wonderful recipes.
Oh,
I even
absolutely.
now like Brussels sprouts, if you can believe it.
Congratulations.
So let's continue with back to you, Dr. Janda. So you've been listening to some of this nutritional stuff, and I know that's kind of your specialty. Maybe a word on that. And then I want to hear more about the kind of clients that you work with, because I know you've worked with some fairly more significant stuff than kind of things that I was working on, right? Or that I dealt with.
Well, it sounds like your stuff is significant also.
Oh, yeah.
Yeah. Dr. Vicky and I work on similar kinds of patients. I don't know that mine are more significant than hers, but I think because I have the LSA, the DRX, I tend to attract more severe back problems. Some of them are quite, severe disc problems, but aside from that, there's quite a bit of overlap between what we treat. So.
Yeah, and that's kind of what I meant. So give us a little bit of an overview of maybe a case where someone's got more of a chronic type of situation, or maybe more of an intense type of injury, accident kind of thing.
Well, once the spine is injured and the discs have been injured, they tend to continue to deteriorate for the rest of your life. Unless you intervene to reverse the process, the discs will get worse each day, each year, until they're completely gone. And there are a number of technologies to try and fix that. Some of them are nutritional, which have some effect on it. Some of them are spinal manipulation and adjusting, which is what chiropractic is known for. And then there are different kinds of distraction technologies, the best of which are the non-surgical spinal decompression, like the DRX. And the reason why that's so effective is because when you try and pull the spine apart to get to the disc, the muscles will guard and they will grip to prevent you from pulling apart. And the machine is designed to sense when your body is trying to contract and the machine lets go. So it pulls on you, and then if you pull back, the machine lets go, and as soon as you let go, the machine pulls again, and it does it every 17th of a second. So it's quicker than your brain can comprehend what's happening. And so what you experience is just that it's very relaxing, because you get in the machine and it's not fighting you in any way, because every time you try and fight it, you win. And so every time you let go, the machine wins. And so it slowly pulls you apart and gets down to the disc, and will start tractioning the disc in a deeper way than you can normally get to. And the therapeutic results are spectacular.
Do you have like a specific actual, I don't want you to mention names or anything, but a profile, and maybe give us a little history, like this person was involved in this situation and that's how they came to see you to use that equipment you were just speaking of?
Well, a couple of months ago, I had a very severe guy, Czechoslovakian man, who was brought in here. He was in such bad shape he couldn't bend straighten out more than 90 degrees, and he was limping badly down the hallway, and he had to have two people helping him come in and all this kind of stuff. And he was in such bad shape that in his case, I had to have him on the machine 4 or 5 times a day. And he virtually lived here in the office, and he just stayed on the floor between treatments, and if someone else would come in, he would get off the machine and then get back on it when they're... But it took about 2 months, and he's completely normal now. And that would have been a surgical case for sure.
So you help your patients avoid surgery?
Oh, yes. Sure.
And I see a lot of that. Everyone in America seems to recommend surgery, without treatment. So
this machine is such a boon to people who are at risk for surgery. I'd say there are some things we can't treat, fractures and things like that, and severe slippages if the spine slips forward and things. We can't fix those, but 95% of most surgical problems can be fixed with the DRX, and so much so that I think it will create a crisis in the surgical.
Well, that would be a good one in our healthcare system. That would certainly be a real positive thing.
Yeah. Oh, it's wonderful. Absolutely wonderful.
That's great. Well, we're going to take another short break, and then when we come back, I'd like the both of you to kind of help our listeners to how would someone self-diagnose themselves, and if they can't come to your clinic, and I do want you to make sure we tell everyone who's in Southern California where you're located so they can reach you, both of you here, and get on a treatment plan. But if there's someplace else in the country, when we come back from the break, let's talk about how they do a little bit of self-diagnosis and maybe find a wonderful clinic to work with like the one you folks have. I'm Gregory Foster, and you're listening to Access Zen.
And now, let's return to Access Zen.
Hi, listeners, and we're back. I'm Gregory Foster, and you're listening to Access Zen. And on the break, we were kind of getting deeper into, looking at the two types of folks, which I think make up most of us out there. Folks like me who have these aches and pains, and maybe we've taken some Advil or gone to our regular medical doctor, but it really hasn't gone away, right? And then the other type of person who's been in a serious sporting accident or car accident or some other chronic thing that just continues to get worse. So Dr. Vicky and Dr. Janda, that probably encompasses most of us, right?
Sure.
So if I'm someone out there in the audience, and maybe I'm a little bit chiropractors, I better stick with my traditional medical doctor. How would you kind of coach them a little bit to open their minds up, maybe, number one? And number two, how would we go about helping them find and search for the right team, like the two of you, how wonderfully you work together?
Well, one thing to keep in mind about chiropractic and traditional medicine is that there have been many studies done on chiropractic, and virtually all of them show that for musculoskeletal problems, chiropractic comes out ahead every time. It saves money, it's faster, and there have been big studies done by the British government and by the Canadian government, the United States government, and every time chiropractic comes out ahead. So it's not a secondary thing at all. As far as finding a good chiropractor is concerned, I think there's a couple things you can do. One is you can talk to people that are going to them and try and get feedback on who what they think is good. You can look at the chiropractor's background. Do they do just adjusting, or are they interested in nutrition, and what kind of extra training do they have? And one other thing that I think could be useful is to look for applied kinesiologists, because I think that the training to become an applied kinesiologist is integrative by nature. It involves some understanding of acupuncture and nutrition and muscle testing and things like that. And the doctors that have taken the great deal of trouble it takes to learn that system are usually well educated.
Yes,
Yeah, Dr. Vicky, you've utilized a lot of those techniques with me, and I found that to be very valuable.
Yes, applied kinesiology, if a chiropractor goes on to obtain the education to be an applied kinesiologist, they've got 2 to 3 more years of education on top of what they've already learned structurally. And so applied kinesiology integrates the function, other symptoms of the body, such as digestive, to the structural elements of a person's situation. And so it really helps to find out the deeper meaning of people's overall conditions when they have these 2 things to pull from in their education. So when you're looking for someone outside of town here, I often have this question asked to me by patients that are, coming from out of town, or their relatives. I give them the same advice that Dr. Janda said, just look at their education, see if they are doing nutrition, if they're applied kinesiologists, what kind of structural work do they do? Do they use radiology? Do they use x-rays? I mean, the more dynamic that the doctor is, the more that they know, obviously, the better they're going to be able to work with your situation.
And then the richness of the background, as we've heard from Dr. Janda, and as we got to know you working with Olympic athletes, when you see those kinds of backgrounds and experiential types of situations that the doctors have been through, it kind of gives you a good comfort sense, right?
Yes, well, you know that when you walk into their arena and their treatment, that they're going to be able to get results for you, at least in a few of the areas that you need help. Like in working with athletes, it's performance now. And when that athlete gets on your table and they're having, such and such problem, you need to know what to do and how to react and do it in just minutes to seconds versus, having 2 days to diagnose something. So people that can react quickly and efficiently, that they basically know what they're doing.
That's awesome. So the word is holistic, and we're talking mind, body, soul, everything.
Absolutely.
So you both have a wonderful practice there. I enjoy everyone that's in your office. How do they get a hold of you specifically if they're in Southern California?
Well, we got a phone number here, obviously. Our number is 949-574-9311. But we also have websites that Dr. Janda has a website, and I do too. And at this time, actually, I think is that on the radio network there where people can actually get a hold of those websites?
Yeah, thank you for mentioning that. So listeners, go to the main webpage, and if you want to get there real quickly, just type in accessnradio.com. It'll take you right to my page, and it'll show their website. What was that phone number again? And you're in Costa Mesa, California, correct?
Yeah, it was 949-574-9311. That's our general number here. And you can do it that way. Also, I have a website for our 5-day health camp. And
tell us about that.
Well, it's the website is drvodonshealthcamp.com. And on that website, you can find out all the information you need to know about personalized plan for optimal health and a hands-on workshop, 5-day workshop. It's kind of like a little mini boot camp, but it really is dynamic in regards to that. We do the comprehensive fitness nutrition testing there. We use the limbic stress assessment. There's daily flexibility, endurance training, motivation, empowerment, health education, and literature. We do PowerPoint lectures every day. We also do stress meditation, breathing. It's just a dynamic program for help to people to get back into their life again. I mean, because most people are so alienated from healthy living, and they rarely have even a half hour dedicated to themselves, like in exercise or meditation. And it's all about work and go, 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 and fast foods. And as Joni Mitchell said back in the Woodstock days, we've got to get back to the garden, and she's absolutely right.
Oh, that's so well said. So say again what we said at the top of the hour, the lean, clean, serene, and that beautiful little saying. I want to hear that one more time.
Oh, isn't that a wonderful one? I often ask patients when they walk in, how do you want to feel? I mean, what would you like to accomplish? And, most people say, I'd like more energy, I'd like to lose weight or whatever. And so this little statement kind of sums it up. I would like to be lean, clean, serene, radiant, strong, and vibrant with an abundance of energy.
I just so love that. Well, Dr. Janda and Dr. Vicky, thank you so much for being on the show, and I hope our listeners took all this to heart, and wherever you are, find someone good to work with you, and your life will change. Thank you so much for being on our show.
Thank you.
All right, listeners, so I'm going to wrap up the show here. Thank you again to Dr. Vicky and Dr. Janda for a wonderful show today. Next week, the show is titled Making Your Career Dreams Come True. That's right, we're going from health right into your career. So you're going to be listening to Dr. David Cooper, a successful executive coach and recent author, and check out this title, called Outsiders on the Inside, How to Create a Winning Career Even When You Don't Fit In. I'm Gregory Foster. Thank you for joining us on Access N. Make it a wonderful, wonderful week. Take care.
Thank you again for being a part of Access N.